ago, Ayurveda was scripted. So whatever information was there in oral started coming onto the piece of paper. So we have Sushruta, Charak Sanhita, Ashtanga over there. But then still, in India in particular, we have that oral tradition of maintaining the piece of information. It was not only about the uses, but about the quality of the products as well. So standardization was already there, like quality, quantity, treatment schedules, they were all mentioned. But not only that, the picking up of the right material on the right time, in the right season, the right part of the plant was also mentioned. So we must be very proud about these particular mentions of the quality parameters in our ancient text. In advanced world, we do know that Taxol from Taxus brevifolia or the vincristine or vinblastine coming from Catharanthus roseus, they were all coming from the ethnic leads. So this is just a sensitization to all of us that yes, diseases are there, but then yes, remedies are there and they are all coming from nature. It is again loud and clear that etoposide or we can say the quinine, artemisinin, let it be any molecule, the first hint came from the nature itself. This is just the statistics of the Ayush practitioners, the natural practitioners within India, and you can see that we have the Ayush, that is Ayurveda, around 4.5 lakh, learned individuals, homeopathy, Unani, the figures are there. But then we cannot underestimate the figure of the tribal healers, those are present in India. So we know that there are around, and these statistics may not be wrong because around 5 lakhs villages in India, at least 2 people who are good in understanding about the traditional practices are there. But are they visible to us? In WHO, we got the place for all Ayush components because their doctrine of principle was fixed. They were standardized and therefore they were accepted. But then in the entire health management system, we are missing out on one particular important component, and that is the healer's knowledge. It was there, it is there, it is being used to save lives and to improvise the health management system. They can deliver pharmacy. We are working with them, so we understand that how deep they work. So they are delivering their services, they are sustainable and self-reliant, they are practiced in any remote level, and they are available, affordable and acceptable. So it is a fact that yes, from the villages side, from the rural side, there is a flush of patients towards the urban side because of the availability of the better health management systems, hospitals and all. But then we cannot even ignore the fact that there are traditional healers and what happened? There are traditional healers to whom many people from urban side visit them. They made a queue in front of their houses because they are not happy with the current mode of treatment available to them in the urban sector, right? So this is the fact. And this is what we see that in India, we had great institutions like, Central Drug Research Institutes and many other, including many labs of the CSIR and all, they are having the mandate of, coming out with the new molecules to address various diseases. But then still, the picture is not very satisfactory and very happy because we have not contributed any, good molecules so far. This is the way how the research goes on, from unknown to then establishing it as a medicine in the sector, and therefore we call it as discovery to development kind of race, which takes around 10 years, crores of rupees to establish a new molecule, but then how it should be. In a Bharatiya way, wherein we have the treasure of information in the form of the traditional healers, our route should have been different. Clinically, it has been established. Safety has been established. What we need to see is whether this non-codified system can be documented. Yes. Who knows this? We need to search. We need to go for them. Who are practicing it? Let us search for them. Recognize the authentic ones amongst them. This is another responsibility that we have. And what can we do for them? So this is the kind of a thing which started in the year 2013 in Gadchiroli with a small, Vaidu Sammelans. And unfortunately, in the first meeting, no Vaidu turned up because of the lack of trust with the scientists. And later on, after working with them very closely, sensitizing them, giving them the protection of their intellectual property and all, then the confidence building started, and now there is a trust and togetherness. I belong to a pharmacology department which also deals as an application and a service to our society to the component of ethnopharmacology. So with our strengths, like we are good in isolation, we are good in quantification of the phytomolecules, we are good in doing the preclinical studies on the animals, right? We extended our hands, and this is first case study I'm going to put across, which was given to us as a healer's input. Patki Kaka, Ramchandra Patki, I would like to acknowledge him. He is no more now, but yes, the way he was practicing and healing the piles patients led us to establish this particular project. And this Dolichondron fulcata, which is the plant belonging to Vidarbha, was taken for the study. You can see that with our expertise, we extrapolated the phytoconstituents which are present, mostly the flavonoids which are responsible from it, and we established its quantity, quality, and then also the in vitro and in vivo, preclinical studies were also done. It means that we, as a scientist, can really support the claims which are made by our traditional healers. So this was the beginning of making the documentation in a scientific way. As we all believe in only scientific evidences, this is the kind of support which is required. So this was the study which I wanted to put across. This was done in our Department of Pharmaceutical Sciences. But moreover, what is important is we acknowledge the presence of Patki Kaka as an author in the research publication and the papers which are coming out of it. This is what is basically required, acknowledging. Another example is from Chennai, our Vaidya Armugam Pandya, right? He developed a product that is Femi Wash, totally based on herbals. He is working as an attendant in the Catholic run hospital in Chennai. He is just an attendant, but he is observer. He is the one who harnessed the traditional information from his forefathers. So he prepared a formulation, and I am very happy to tell you that after extensive study and comparison with the established brand in the market, we got best results with the herbal combination. He says that in vaginal infections, the product works best in the alkaline pH. And that theory of his was proven by the in vitro studies. What I believe is that these people are not only now practicing, but they are also making a formulation which can be commercialized if supported properly with the scientific data. This is the third one, which was there in diabetic nephropathy. Again, it was contributed by Ramchandra Patki Kaka. And very common drugs, Pedalium murex, छोटा गोखरू जिसे हम लोग बोलते हैं, Hordeum vulgare, that is जौ, and Triticum ratio, यानी हमारा अपना गेहूं, right? उसका जो ज्वार होता है, so that was used, and the complete study on kidney hypertrophy was done in the department. So this is all what I'm trying to say is that yes, whatever they are claiming, let us just check at least, confirm it, validate it. And then another healer from our Meerut, who was a forest guard, and he became the forest resource person for the forest the Institute of Forest Research in Dehradun. He started going and delivering the talk to the IFS people who are going to cover the forest in entire India. So the connect of these people with the nature and with the plants is significantly high, and we really need to appreciate that. What happened is here, in his case, his son became BAMS, doctor. And then whatever knowledge it was there got translated into a very structured way. And we can see now the research publication directly coming from the traditional healers. This is what is expected, and we are supporting that. This is a story of Sambalpur University's Department of Biotechnology and Bioinformatics, who has done all kind of toxicological and efficacy studies for a product which was called as Uritone, done by our Vaidya Santanu Vidya. These are the stories which we really need to take further. This was the first conference in Nagpur, which was of the Society for Ethnopharmacology, with a wonderful team of scientists all across India as well as international. They all came together for this cause, and the story started strengthening from 2015 onwards. In 2016, it was Vijnana Bharati who is responsible for organizing the World Ayurveda Congress with Ministry of Ayush, supported our idea. And this was the first conglomeration of the traditional healers of India. Around 120 members were invited from all across, 15 states were there. They were the resource persons, we were the listeners. They were the resource persons, our scientists from Ayush, from AIMS, from all, branches of modern sciences. They were listening to them in their dialect, right? So this was the first effort. So far we have completed 5 projects, 5 more are going in progress, and we want to have more and more scientists to work for them. Now while working for them, you need to have 2 goals. First is, you are not doing it for your own self. Don't flash your work only without, acknowledging their presence. We must have to have access benefit sharing for them, which is an international norm, which we also need to understand and study. And therefore, this integration here, Dr. Y.K. Gupta and many ICMR top-notch, they were engaging with them. In Nagpur, we had this Lok Swasthya Parampara Samvardhan in 2017. So the efforts has to be consistent. That is what I am saying. It's not only fluke and just come and enter and go, right? You need to be consistently with them to understand what is really happening in this world. In COVID, yes, we had prepared the karas based on, so all over India there were karas, right? They were all different because they were all using the local flora and fauna for the management of immunity, for the management of corona. In Nagpur also, I myself was involved in preparing the kara and we were distributing it to the police force, to the bajiwala, right, to our maid servants, and this is all possible, right? We found that this is really working. In Panji, Ahmedabad, it was in 2022, and then we started acknowledging, we got the appreciation and acknowledgement through the Indian Pharmaceutical Congress that was held in Nagpur University, and we really found that a lot of support is coming. This was very recent. In 2024 December, we had it in Dehradun, and now people are coming really forward, even from both the sides, from the administration side, from the government side, and from the researcher side as well. So these are the outcomes. These are 2, wonderful stories. I won't go into detail, but you need to have this kind of connect. This is the palace of that
traditional healer who harness, wonderful piece of traditional knowledge. He's the one who is having, so many iCards in his, right? He's a wonderful resource in many international conferences. He's a traditional
healer. He sells his medicine online, right? And it is possible because now the GPay and all that management is there. There is another healer from Sikkim, right, who doesn't give any medicine. He is a faith healer. But can we not acknowledge even that?
Can we not really do the research and study that how the faith healing or the prayer healing works, right? Even that is also our responsibility. So this is the entire mechanism on which we are working. We are identifying them, putting it in the repository, we are documenting, we are connecting them with the scientists for exploration of knowledge and then entering them into the commercialization and benefit sharing concept. So Vijnana Bharati came forward to take all the traditional healers of India under its umbrella, and we have started their Panjikaran under the Vijnana Bharati. So this Panjikaran form, this registration form asks you from whom you got the knowledge, right? Whether it is the father or your guru or your teacher, and whether you are delivering that knowledge to the next generation or not, right? These 2 major components are there in this form, and we are very happy that we are getting, in just 1 month, we have got more than 1,500 forms with us. So a great database is being created, and this is what we propose. This is almost the last slide. So the Vijnana Bharati proposes better collaboration between traditional and modern healthcare system by education and training. So cross-training needs to be there. Both of us needs to be sensitized. Integration into healthcare policies, community-based approaches, joint research and evidence-based validation, then respect for cultural context, patient-centered care, and promoting public awareness and education. So more informed society is required, for which we all can be instrumental. So digital platforms can be used, and this is what we have already started doing. You just need to join hands with us. So preserving traditional healing requires a balance of respect for the past and adaptation for the future. I'm also proudly associated with Santa Foundation, whose The director, founder director is Purushottam Agrawal, alumnus of our Department of Pharmaceutical Sciences, doing a great job. And with his team, I think we are going to have a show, just a description about Samta Foundation immediately after my talk. And then this is the summary of mine. It says that preserving the holiness, aesthetically extending technological advantages, and developing scientific evidences by keeping the heart, mind, and intuition all together receptive. Don't boast that we have learned so many things. There are so many things that we do not know. Let us connect with those who know it. Let us join hands to preserve our ancient health management heritage. Their approaches to health and wellness can complement modern medicine for holistic wellness of mind, body, and spirit. I believe more can be done, but we have a very less time. Most of our traditional healers of India, they are 60 years plus. Last example, Dehradun, we had invited the healers, and one of the healer could not come. He was 85 plus. He died, right? And we lost treasure of information which was along with him, right? We need to catch them young, and we have only 15 to 20 years more. We need to work hard. We need to really focus upon them, because we are the country who believes in welfare of everyone on this globe. Sarves bhavantu sukhinah. Sarve santu niramay is a work, and this is the field wherein we have the knowledge. If we really catch it, if we really extrapolate it, translate it, then India will have one reason to become Vishwa, right? This is what I feel, and I really wish to again end with a prayer for all of you and for the universe, with this universal prayer. Ye Ishwar sabko sanmati de, आरोग्य दे, सबको सुख दे, आनंद और ऐश्वर्य दे, सबका भला कर, कल्याण कर, रक्षण कर, और तेरा मीठा नाम मुख में निरंतर रहने दे. So thank you for patiently listening. Thanks to all organizations with whom we work, and we learned from them that there is a lot to be done somehow. Thank you so much.
Welcome to a journey of impact.
survey, solution and services delivered into a single cohesive effort. I say that this is a Triveni Sangam. Unlike many studies that stops at identifying the magnitude of the health problems, Blossom offers a complete actionable framework, that is SSS approach. Coming to the variables under Blossom, the name Blossom is not just a catchy term. Actually, it is catchy, isn't it? But it is an acronym encompassing the range of diseases and health issues covered in the project. While traditional studies among tribal population focuses primarily on malnutrition, anemia, and non-communicable diseases, Blossom breaks new ground by uncovering the prevalence of critical conditions like liver disorders, breast cancers, sexually transmitted diseases, and osteoporosis. Furthermore, we also explored health-seeking behavior and healthcare utilization amongst them. Which is a crucial insight for crafting the actionable solution in the phase 2. Now coming to the sampling, how we did the sampling in the Blossom. Actually, as you can see, Maharashtra has 36 districts and 6 divisions like Pune, Nashik, Aurangabad, Amravati, and so on. Nagpur is one of the divisions. But it was Nagpur. Otherwise, this project would have gone to some other division. So Nagpur division has 6 districts. Among these 6 districts, Nagpur, Gondia, and Chandrapur and Gadchiroli is having predominantly the tribal population. So all the villages having tribal population of more than 80% were selected from these districts. So in total there were 18 villages which were selected. Every tribal household in the village was included in the study. This systematic approach ensured that the data was representative and comprehensive. Next, coming to the data collection, after sampling, the pre-tested and pre-validated questionnaire was filled by interview techniques. The interview begins with the household questioning, seeking information regarding socio-demographic characteristics of the family, followed by questionnaire for women and children and questionnaire for men. So all family members were covered. This was followed by measurement of blood pressure and anthropometric measurements like height, weight, waist-hip ratio and neck circumference. Weight and height for children above 5 years and weight, height and midarm circumference for less than 5 years. The lab technicians collected the blood sample of all the family members following all aseptic measures, which was sent to the designated laboratory for analysis. Now, one of the unique features of Blossom again is multidisciplinary approach. Collaboration was the cornerstones of Blossom's success. Our team of several diverse group of individuals like faculty, postgraduate and undergraduate students, experts from modern medicine, Ayurveda, homeopathy and Unani also. Alongside, we have NSS volunteers, teachers, health workers, ASHA workers, community leaders and lab technicians. Working with such a multidisciplinary framework enriched the learning experience of all involved. Though the work was
recording one.
talking about the collaboration and multidisciplinary approach of Blossom. Every effort a story of resilience. This project and finally, I extend my deepest gratitude to Team Blossom, whose tireless efforts and passion made the
One very critical concern in this region particularly is the sickle cell disease and the sickle cell trait. These conditions disproportionately affect tribal populations, especially in regions such as Maharashtra.